Shin splints is common for those returning to a running program, initiating a running program, or doing a form of cross-training involving running and jumping. Oftentimes, shin splints is characterized by pain around the shin or the tibia here. The presentation, though, of these symptoms can be a little different. Sometimes the pain's on the inside, sometimes the pain is on the outside. Okay, medial tibial stress syndrome is usually when we're having the issue on the inside of this tibia. And this can be managed and helped out with some manual therapy that you can do on your own. So to help out medial tibial stress syndrome, what you need to do is find your tibia, just that big bone in the front of the shin. You're going to take your thumb and go nice and slow, pressing down and up into the kind of the back of this shin bone or tibia. There's going to be some real tender spots in here, especially if you have this condition, so make sure you go nice and slow. Once you find a tender spot, just stop on it and then move along. Once again, go nice and slow up this whole trek. If your legs are hairy, if you're a gorilla and a little closer to some of those primates, make sure you grab some lotion and then just have a little easier gliding here as we move up. When you're doing this, make sure you're going all the way up to the knee joint or as high as you possibly can. Okay, so this is how we can work the inside of the tibia. If we're having our symptoms more on the outside, we can also work that. What you're going to be doing here is finding, once again, that shin bone. Then you're just going to be going down and in, pressing with that thumb, trying to break up any of those adhesions that we may have, adhesions in the muscle, adhesions in the fascia. Once again, down and in as we're working this. Okay, this is usually just one aspect of improving these symptoms, but they can help out quite a bit, especially if we're having tenderness as we get back to running, jumping, or starting any running training program. So this is a self-myofascial release for shin splints.